morning. So I want to talk to you today about when you are on SSDI, Social Security Disability. When you are on Social Security Disability for 24 consecutive months, you will automatically get Medicare, Part A and Part B. A is in apple, B is in boy. Once you are on that, you do not, especially if you're under 65, you do not have to stay on ACA or Affordable Care Act, or for lack of better terms, Obamacare. You can go to a Medicare Advantage plan, also known as a Part C, or sometimes they'll be called MAPD. M is in Mary, A is in apple, P is in Paul, D is in dog. Medicare Advantage prescription drug plan. Or you can go the Medicare supplement route. That will be expensive, very expensive, if you are under 65. Now, they can be very expensive already, but they're going to be more expensive if you're younger. If you have Medicare, I suggest that you get onto a Medicare Advantage plan, and then when you turn 65, you can go ahead and get onto a Medicare supplement. The reason why is because there's no reason for you to be paying for your Part B premium and also be paying for ACA. It makes no sense. Go on a Medicare Advantage plan where 99% of them have a $0 premium, and you still have to pay copays. You still have to have a max out of pocket, where on the ACA you're going to have a deductible, and they're kind of large. So anyways, I had a conversation with somebody yesterday, and he's on SSDI, Social Security Disability, and he was talking to a carrier, and they were trying to convince him to get onto a ACA or Affordable Care Act plan. And when he called me, I was like, that's crazy. There's no reason to do that. You have Medicare already because you've been on SSDI for 24 consecutive months. So we'll put you on a Medicare Advantage plan. So I compared the two for him, a ACA plan versus a Medicare Advantage plan. And it's a no-brainer. $0 premium, low max out of pocket, where you have a high deductible. Difference between a max out of pocket and a deductible. Max out of pocket means that that is the most that you're going to pay for your health care that year. So whether it's $1,500, $3,400, you're not paying $3,400 out of pocket before the coverage starts kicking in. You just pay your copays, and once your copays add up to that amount, then you stop paying copays for the rest of the year. January 1st, you reset. A deductible, on the other hand, is something that you have to pay out first before your coverage kicks in, right? Certain things are covered, like, maybe wellness shots or something like that. But if you have a hospital stay before your insurance picks it up, you have to pay that deductible. Most of them are anywhere between $5,000, $6,000, $10,000, and $12,000 and $15,000. So it makes no sense to have Medicare and ACA. It makes more sense to have Medicare and a Medicare Advantage plan, also known as a Part C. If you guys have any questions about that, please put them in the comments and we'll talk about it. Have a great day.